Language of Caring helps healthcare organizations achieve an unparalleled patient experience and a culture of caring through exceptional communication.
I kicked off the session. It was a half-day session with this group, and Jill started talking to this group about the premise, the understandings, the basics of language of caring. And I was able to stand there and look at the faces of people in that room, and I saw an energy that I hadn't seen about a lot of things. I see it and I hear stories about it in my everyday work. I'll have people come up to me and say, I had a very difficult family I was dealing with today, and I used language of caring tools and it really worked. That's very rewarding.
Language of caring resonated so much with the work that we were already leading with family-centered care. It gave us a framework that bundled everything we've been teaching and everything that we've been trying to do. It pulled it together in a curriculum that was easy to deliver, easy to understand. That's what language of caring gave us, and it worked. So we love it. We started in the ambulatory network, and we trained all of the site managers and medical directors. Every single one of those managers, we have over 30 sites across the region, came back and said, we need to get this to our staff now. We had the docs, we had the nurses, we had the frontline staff. Everybody was there with us and hearing the same message. And you could see the light bulbs going off. And so all of a sudden, people started to see all the different angles that goes into care and how they need to be unified and how they need to have consistent conversations with patients and families and with one another. And that, I think, was really great in terms of our implementation. It was that it got everybody engaged. It didn't leave anyone behind. It was just not for docs, just not for nursing, not for social work. It was for everybody. And it's communication skills. Everybody uses communication skills. I'm enthusiastic about it because it works. In certain areas in the ambulatory networks, we saw an increase in patients' ratings in terms of their overall experience working in those centers. To me, it's not about those scores. We can talk about outcomes all the time. It is about making sure your staff can say, I feel confident and comfortable communicating with families. Not only did we see kind of our ratings go up, but we also saw an increase in our families getting engaged and involved in their care differently, which means as providers, we were setting the stage to say, please work with us. And that's what happened with the language of caring. When we started to say, I know you're so invested in your child's well-being, help us come up with a better care plan. Patients and families were saying things to us that they have not been saying before because we changed the conversation. You can feel it when you walk into clinics and you feel the level of engagement and you feel the comfort of staff who are working together in a very different way than they had previously. And it's every single person who has had contact with this. It's taken flight and it's just been great and helped us push the envelope in terms of really being family-centered.
The important language is necessary, that information you need to share, but couching it with that supportive, the heart, head, heart piece, that sandwich, that's your how-to. And that's how you're opening that other person's ears to hear you and trust you. A lot of the material talks about frustrating moments, difficult times, challenging situations, but the reality is that this is how we should be talking to each other all the time.
My first exposure to language of caring was really very profound because in listening to the skills and listening to the actual material, it really resonated with me and struck me that on many of my most challenging and difficult times here at the hospital as the mother of a patient, I realized that what may have been missing from those encounters were some of the language skills that are taught in language of caring. I met with a team that was feeling very dissatisfied, feeling very frustrated. They were dealing with a very difficult situation and they were really sad about it. I showed how language skills could help them reconnect with this family. And when we were finished, there was just a moment of silence. There were no questions. And the senior attending leaned forward and said, "That was so profound and helpful. You will never know how much you've helped us." The reaction from staff has been very significant. They're very surprised. They're very ecstatic. You're kidding me. That's all I have to do to bring family-centered care to life. You can take the same 2 to 3 minutes and make it a completely different experience for a family that will be remembered 20 years from now as very satisfying.
Most of us who are in these roles recognize you can't just have a flash in the pan gimmick that you kind of sell out there and it suddenly increases the way people engage with you and partner with you. It takes real hard work, and you have to do it in a way that is really, you focus on the fundamentals and you implement something that staff can grab onto. And I haven't found anything that staff have grabbed onto and said, this just makes sense, other than language of caring.
Why should another children's hospital implement this? I think any hospital should, first of all. However, in the children's hospital world, remember that in many ways, children's hospitals are specialty hospitals. They're referral hospitals. And how do we get our business? How do we know people will come to us? It's because they know they're going to get the best care, the most passionate care here. So it's word of mouth that spreads that way.